Hello, and welcome to Making Connections, a program for improving care for women experiencing domestic violence, mental health, and substance use problems. My name is Jenna Evans, and I'm a researcher with the Institute of Health Policy, Management, and Evaluation at the University of Toronto. In this presentation, I will provide an introduction to models and best practices for leading organizational change. The English verb lead comes from the Indo-European root leith, which means to cross a threshold. In other words, to lead is to reach a point or level at which something new emerges. Leading, then, is fundamentally about managing change, whether it is internally, as part of our personal and professional development, or externally in the teams and organizations we serve. It is quite common for leaders in the health and social care sectors to believe that their own organizations are fine and that it is the system that needs changing. This attitude inevitably creates a barrier to improvement. A 2011 report on transforming Canadian systems of care describes organizations as the engine for delivery and change. Organizational change is thus an essential ingredient for driving and supporting system-level improvement. Overcoming historic silos between organizations and professionals to deliver integrated client care demands both organizational and systems change. Women who experience domestic violence and abuse, for example, are often dealing with other issues related to mental health and substance use, but their experiences of these concurrent problems are often neglected, misunderstood, or inadequately addressed. The good news is that the evidence base on best practices, treatment modalities, and models of integrated care is growing. Organizations are thus responding to the needs of these women in a variety of ways. Some have implemented a zero tolerance or harm reduction policy. Others are implementing screening tools to help identify priorities for action. Organizations are hiring new staff and introducing staff rotation and training programs. And some are fostering partnerships with other organizations to coordinate services and share information. But the challenge for leaders lies not just in identifying promising strategies for integrating care. The challenge is in making change happen and sustaining it. To better understand organizational change, we need to explore the why of change, the what of change, and the how of change. Let's begin with the why. Organizational change can happen in response to external demands, such as a change in funding or evolving client needs. Or it can occur in response to internal forces, such as management turnover or staff feedback. Change can also be proactive, implemented in anticipation of an emerging need or benefit, or it can be reactive, executed in response to some stimuli. The focus of change, the what, may be an organization's structures, processes, or culture, or a combination of these. Structural change targets things like the organizational chart, strategic goals, and policies. Process change modifies how things are done and how people interact, such as new models of teamwork, communication, and clinical decision-making. Cultural change involves fostering new attitudes, beliefs, values, and behavior patterns. It is helpful to think of your organization as an iceberg. Structures are at the very top. They are visible and explicit. Processes are in the middle, and culture is at the very bottom, well below the water's surface. To effectively implement change, regardless of scale, leaders must maximize alignment and synergy among all three levels. Why? There are three reasons. First, because structural change alone often does not modify processes or behavior patterns. For example, the evidence on integrated care suggests that merging organizations does not necessarily result in an integrated client experience. This is usually because care is still being delivered the same way, despite the structural changes. But changes made to processes without attention to structures are often unsustainable. For example, a new model of teamwork may be successfully implemented, but if no changes are made to job descriptions or organizational policies to help reflect the new model, the model may not last, particularly with staff turnover. Finally, attempts to change beliefs and behavior patterns without attention to structures and processes often fail because they target individuals and neglect the environments within which they work. For example, staff members may learn to value teamwork and shared decision-making. But if the organization's reward system is based on individual performance, and if there are no formal opportunities that support collaboration, staff will inevitably fall back into old habits. A systems perspective is needed to consider how the various elements in an organization are connected and how they may support or contradict a proposed change. This brings us to the how of change. Organizational change can be emergent, arising naturally over time, or it can be planned and implemented in an orderly fashion. Planned changes typically involve the use of various steps and strategies, such as dialogue, champions, dedicated resources, training, and feedback. Numerous theories and models of organizational change exist, and they emphasize different aspects of the why, the what, and the how of change. However, they all share two common themes. First, that change is not an event. It is a complex process that occurs over time. And second, that change is fundamentally about people, their knowledge and skills, their motivation, and their openness to change. When you crack open a soda can, pressure and energy is released, and gas bubbles wiggle free from the liquid and rise to the surface. Over time, however, when all the carbon dioxide is released, the beverage becomes flat. It fizzles out. Unfortunately, change efforts are also prone to fizzling out, whether due to resistance to change, a lack of resources, or poor change management. Reports suggest that around 70% of organizational change initiatives fail to deliver on their objectives. So how can leaders managing change keep the fizz? It is helpful to fully embrace the soda metaphor and to think of change in terms of forces and energies that need to be balanced and replenished. There are a few change models in the academic literature that help us to do this. I'm going to highlight three. The first is the force field model, proposed by Kurt Lewin in 1951. He described organizations as systems, which are held in a constant state of equilibrium. The model suggests that a range of driving forces, which exert a pressure for change, are balanced by a number of opposing resisting forces. Driving forces urging change might include things like economic pressures, new clinical practices or technologies, or client demands. Resisting forces might include a firmly established organizational culture or staff fatigue from participation in multiple change initiatives. Lewin elaborates on this by describing change as occurring in three steps: unfreezing, changing, and refreezing. Unfreezing involves communicating the need and fostering the motivation for change. Changing occurs when people start to think and act in ways that support the new direction. And finally, refreezing involves internalizing and institutionalizing the change so that it becomes a part of everyday practice. Lewin's models remind us to take time during the planning phase to consider how to maximize the drivers of change as a way of unfreezing behavior, while also considering the various factors that influence individuals to maintain the status quo. We can use the stages of change model to unpack what happens at an individual level during unfreezing, changing, and refreezing. According to this model, individuals progress through 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. The two-way arrows in the model show that relapses are possible at any point during this process. This model gives us a sense of the energy expended and the energy required of individuals during the change process, as they become aware of the need for change, make the intention to change, implement specific modifications to their behavior, and then work towards maintaining those behaviors even as they experience relapses. Now, the stages are not necessarily linear, and individuals don't always make logical and explicit decisions about changing. But this model reminds us that change is a process that individuals will accept and move through at their own pace. It also reminds us that ongoing reinforcement can help to overcome the inevitable relapses. And finally, we have the Energy for Change model, an innovative model that has been developed and used in the English National Health Service over the past 2 years. What are the factors that influence the energy and momentum with which change is pursued? This model attempts to answer that question. The model suggests that leaders must tap into and nourish the positive energy for change in their organization. There are 5 types of energy for change: social, spiritual, psychological, physical, and intellectual. Social energy is energy from relationships with others. It involves building a sense of us and building solidarity for change. Spiritual energy is energy from belief in the value of the change and in a shared vision of the future. Psychological energy is energy from feeling safe and supported to make the change, believing in oneself, the team, and organization, and trusting in leadership. Physical energy is energy from getting things done and making progress. It involves balancing intense energy expenditure with opportunities for reflection and renewal. And finally, intellectual energy is energy from planning, analysis, and learning. There is a tendency in change efforts to focus primarily on physical and intellectual energy. In other words, there's a tendency to focus on planning and executing the change and measuring progress. This model reminds leaders to also recognize and nourish other types of energies, such as spiritual, psychological, and social energy for change. Doing so helps make change meaningful and important to staff, and helps foster respectful, supportive, and trusting relationships between those leading the change and those most affected by the change. Peter Drucker, one of the most influential management theorists, said, "Your first and foremost job as a leader is to take charge of your own energy and then help to orchestrate the energy of those around you." In summary, you can maintain the fizz in your change efforts by balancing the driving and resisting forces for change, by recognizing the demand that change makes on individuals and reducing it wherever possible, and by fostering and balancing the various types of energy for change. These overarching models and principles can help you assess and increase your organization's readiness for change. The concept of organizational readiness refers to an organization's flexibility and ability to adapt to change. More flexible organizations have often developed a learning culture where continuous change is the norm. Building a learning culture comes not just from what leaders say, but from the seemingly mundane actions that leaders take. So, what gets noticed and rewarded? What is discussed at meetings, and how does a leader spend his or her time? If leaders approach some types of mistakes as opportunities for correction and learning, convey a sense of energy towards achieving change goals, and are willing to try new things, staff are likely to view change very differently than if leaders punish or ignore mistakes, seem indifferent to change goals, and avoid experimentation. 4 cross-cutting and interrelated themes that drive both successful change and the development of a learning culture are open communication, staff empowerment, measurement and feedback, and continuous problem solving. Open communication with staff and other key stakeholders is essential. There needs to be dialogue, and the key question is not just what do we want to change, but also what do we want to conserve? Having this conversation early on helps to clarify the scope for change and identify the organization's key strengths and values that will be retained and reinforced. It also helps address the fear that often accompanies change. Through regular two-way communication, the change initiative can be modified in real time based on input and feedback from multiple perspectives. And problems can be identified and addressed before they escalate. Eliciting and using staff feedback really helps empower and engage staff in the change process. Other ways to empower and engage staff include to identify and leverage champions and opinion leaders, to provide training and education, and to share performance data. When staff are included in the change process, their buy-in increases. They have more time to prepare cognitively for the change. They are more positive about the change, and they come to see themselves as agents for change. Now, there are risks. Allowing for a more inclusive change process does raise the possibility that the process could stall or derail. However, this problem can be mitigated through strong leadership, a clear vision of the desired future, and ongoing evaluation of progress. To maintain momentum and promote ongoing problem-solving, learning, and change, many organizations engage in rapid cycle testing using the PDSA cycle. PDSA stands for Plan, Do, Study, and Act. In the plan stage, the team identifies an objective, develops a plan for implementing the change, and outlines how data will be collected to measure progress and impact. In the do stage, the plan is carried out, and observations are made and recorded about any problems or unexpected events. In the study stage, the data is analyzed and the results are determined. And finally, in the act stage, the change is modified based on what was learned and either retested or spread. When applied in a continuous fashion, these 4 steps form a quality improvement strategy. The value of the PDSA cycle lies in its focus on small-scale change. Small scale refers to the size of a test. For example, a PDSA cycle can be used to test a change for a couple of hours or days in one particular unit or program. The change itself may be quite innovative and a significant departure from current practice, but the scale or size of the test is small, which makes it relatively easy to carry out. When appropriately applied, the PDSA cycle incorporates all 4 of our key themes: open communication, staff empowerment, measurement and feedback, and continuous problem solving. It can thus help your organization's readiness for change and foster a learning culture. Peter Senge is an academic based at MIT who developed the concept of the learning organization in his best-selling book, The Fifth Discipline. He says the following about change. You cannot force commitment. What you can do is nudge a little here, inspire a little there, and provide a role model. Your primary influence is in the environment you create. The concepts and models we've covered provide direction and guidance on how to foster a work environment that supports change and improvement. Here is a recap of our key messages. First, look at the big picture. How do your organization's structures, processes, and culture support or contradict the proposed change? How can you maximize alignment and synergy among all 3 levels during the change process? The key leadership skill here is systems thinking. Second, focus on people. How can you motivate and support staff to engage and to take ownership of the change process? How can you balance and replenish the various forces and energies for change in your organization? The key leadership skills here are communication and team building. Third, apply a suitable model. Which change model or parts of different models resonate the most with you and your organization? How can you use this model to help drive change? The key leadership skill here is knowledge translation. And finally, encourage continuous problem solving and learning. How can you create a work environment that supports innovation and experimentation? The key leadership skills here are role modeling and facilitation. In closing, let's revisit the reason we are here, which is to make connections, to determine how to better support women who are experiencing domestic violence, mental health, and substance use problems concurrently. Through the effective leadership of organizational and systems change, you have the opportunity to improve services to better cater to the complex needs of this population. At the beginning of this talk, I compared leading to crossing a threshold, being able to identify, advance towards, and traverse the point at which change emerges. This is a feat not possible without collective and sustained energy. So the next time you crack open a can of change, be sure you have a plan in place for how to keep the fizz. Thank you.